Hello, good day. Welcome to our class in Community Health Nursing. I'm Ms. Jed and I will be your teacher for this subject. All right, so for today, we will discuss about the second lesson of our first module, which is entitled The Different Fields of Community Health Nursing. And for this day, we will specifically talk about the school health nursing or the school nursing. The practice of school nursing began in the United States on October 1, 1902, when the initial role of the school nurse was to reduce absenteeism by intervening with students and families regarding healthcare needs related to communicable diseases. While the nurse's role has expanded greatly from its original focus, the essence of the practice remains the same. The school nurse supports the students' success by providing healthcare assessment, intervention, follow up for all children within the school setting. In 1999, the National Association of School Nurses Board of Directors defined school nursing as a specialized practice of professional nursing that advances the well being, academic success, and lifelong achievement of students. To that end, school nurses facilitate positive student responses to normal development, promote health and safety, intervene with actual and potential health problems, provide case management services, and actively collaborate with others to build student and family capacity for adaptation, self management, self advocacy, and learning. Inherent in his definition is the framework that school nurses engage in professional nursing practice, use the nursing process for decision making, document the care they provide, and assure confidentiality. Professional nurses address the physical, mental, emotional, and social health of their clients. In addition, professional school nurses have, as the ultimate outcome of their practice, the support of student success in the learning process. In this context, the school nurse provides services to the entire school population, which may include infants, toddlers, preschoolers, children with special needs, traditional school populations, and, to a limited degree, adults within the school community. The Department of Health in the Philippines defines school nursing as a type of public health nursing that focuses on the promotion of health and wellness of the pupils or students, the teaching and non-teaching personnel of the schools. Nurses also assist young people in making healthy choices, reduce risk-taking behavior, and focus on issues such as prevention of drug and substance abuse, teenage pregnancy, sexually transmitted infection, malnutrition, and communicable and non-communicable disease. Here in LaSalle University, we are very privileged that we were provided with different clinics catering different ages from preschool to college. We have one clinic in the main campus, another clinic in the integrated school, and another clinic also in the senior high school building. Now, let us talk about the objectives of school nursing. Its general objective is to promote and maintain the health of the school populace by providing comprehensive and quality nursing care. When we say school populace, that includes the pupils, the students, the administrators, the teaching and the non-teaching personnel or the staff. Now, let me ask you, how do we provide a comprehensive and a quality nursing care in the school setup? I'll give you 5 seconds to think of the answer. Okay, so while most of us may not be able to articulate or dili na to maistorya such an illustrious definition of quality care, we know it when we see it. Kabaluta kung makita nato. As a nursing student, you will likely be introduced to lectures and literature that stress quality care. Now, once you graduate, you will likely to strive to work for the healthcare facilities that offer quality care. For that reason, it's important that you understand what some of the parameters mentioned above should look like. So, in the provision of comprehensive and quality nursing care, there must be an effective care. Services should be based on scientific knowledge and evidence-based guidelines. Now, we must provide a safe care. When we say safe care, quality health care should minimize risk, or it should minimize harm to users or to the patients. It should avoid preventable injuries and reduce medical errors. Also, in the provision of the comprehensive and quality nursing care, it must be timely. Okay, there should be a timely care such that delays in providing and receiving health care should be minimal. And also, we must include equal opportunity. Healthcare should not differ in quality depending on a person's gender, ethnicity, race, your geographical location, or socioeconomic status. Meaning, dili ta dapat, or as students or as nurses or as student nurses, dili ta dapat mamili o kinsa atong hatagan og quality nursing care, regardless sa ilahang status sa kinabuhi, mapobre, madato, kung sa pa na din ha. And there should be efficient healthcare. The healthcare should be delivered in a way where waste is avoided and resources are maximized. And lastly, people and culture centered. The healthcare should take into account that individual and cultural preferences and aspirations of the community that is being served. Okay, so let's now go to the specific objectives of school nursing. First is provide quality nursing service to the school population. Again, in the provision of healthcare, it is the extent to which healthcare services provided to individuals and patient populations improve desired health outcomes. So, kinsa atong client aning school health nursing? Okay, so as mentioned, dili lang ang katong mga estudyante, it also includes the administrators, the faculty, and the non-teaching personnel. So kung unsa ato ang quality of care nga gustong ihatag nato sa pasyente, i-apply pod nato na sa ato ang mga kauban sa school, okay, sa ato ang mga clients. And kani nga mga clients po tong na-mention nato kanina nga members sa ato ang school populace. Again, we are very privileged nga dinhi sa school, dili lang ang mga college students ang gina-cater sa ato ang nurses sa ato ang clinic or sa atong school clinic. We also have another satellite or a branch in our integrated school, and we also have another clinic in the senior high school. And kani siya nga mga clinic naglantaw sa health and sa welfare sa mga students o sa uban pa nga member aning community. Our second specific objective is create awareness among school children, personnel, and administrators on the importance of promotive and preventive aspects of health through health education. Now, one very important role kung mahimo na kang school nurse kay maghatag ka og health education. Magkandak ka og mga seminars, campaigns para sa mga students o sa mga faculty and other non-teaching personnel sa eskwelahan. Okay? So, sa inyong na-experience during your school nursing in Oksat and in City High or Sam City National High School, naghatag ta og mga health education programs or campaigns sa HIV, sa STIs, mental health, and the like. Now, third is we encourage the provision of standard functional facilities. So, dili kompleto ang isa ka school or ang isa ka university kung wala na siya school clinic. Okay, naani siya sa balaod. Dapat tanang school is dapat na ay school clinic. Ma-provided og mga school clinic. Bahalag walay dili permi Let's say, for example, in public schools. So, since there are a lot of public schools in the Philippines and limited lang ang mga health personnels, there are teachers or there will be teachers na will be assigned sa different public schools. Sila ang mo-cater sa health needs sa student in the absence of the school's physician or the school nurse. Next, we have encouraged the nursing personnel with opportunities for continuing education and training. So, as school nurses, gina-require said me nga mo attend og mga seminars, okay, mga continuing program for continuing education, okay? Uh, like for example, in La Salle University, ginatagaan mi nila og before ginatagaan mi nila og fund for research for our seminars and para mag-comply sa amo ang requirement para sa amo ang CPD. So, naami siya allocated budget para ana, yearly allocated budget for continuing education and training. Fifth one is conduct and participate in researches related to nursing care. So, as school nurses, dili lang kay naami din ha sa amo ang clinic every day. Kaya wala mig lang ginabuhat mag-treat sa mga pasyente namo. Okay, of course, nag-participate gihapon mi og mga scientific or medical researches related sa amo ang profession. Next, we have number 6, establish or strengthen linkages with government and non-government organization and agencies for school community health work. Okay, so the same as true with amo ang program sa una. Whenever there are programs sa DOH, the Department of Health, and sa LGU, nag-participate pod ang school sa mga health advocacies or health programs na gina-implement sa national and sa local na level. And ay mga invitations, sometimes ang mga speakers namo is gikan sa DOH, usahay pod kami ang maghatag og talk didto sa uban nga mga schools kung naay mga symposium, okay? And kana pong kanang timbakuna bitaw. Okay, kanang kung timbakuna every deworming every January and July, we also participate that kind of activity. Though it is not mandatory, but or dili siya required, pero open ang school, maski pa og private school ang LSU, open ang mga students and ang mga parents nga mo join sa inana nga mga activities. Okay, next we have the duties and responsibilities of a school health nurse. Okay, so naay mga 9 ka-duties and responsibilities ang SHN. First is ang health advocacy. Okay, as mentioned a while ago, it is our task or it is our responsibility as school nurses na maghatag ni og talk regarding sa health, regarding sa uh, proper nutrition, okay? Daghan kaayog mga topics, mga health topics nga amo ang gina-impart dito sa school population. Second is health and nutrition assessment, including other screening procedures such as vision and hearing tests. Okay, so every year, every section or every year level, ang mga bata is nagaadto sila sa clinic for their vision and sa hearing test. Dili kaayo siya common din sa Philippines since limited lang ato ang machines na available in hearing. But vision test, okay, we use the Snellen chart, okay, para ma-assess ang visual acuity sa mga bata. Third is as a provision of the health and safety of the school plant. When we say the school plant, it's the entire physical environment or the physical plant of the school. Okay, gikan sa mga buildings, gikan sa mga offices, tanan na siya. Okay, so we also supervise the canteens o unsay mga sulod nila nga mga pagkaon nutritious ba siya, healthy ba siya. Kung katong mga bawal, we do not allow vendors or kanang mga canteen concessionaires nga mag-sell ana niya. And every year, I think murag every quarter na ay mga nag-anha nga mga sanitary inspectors from the Department of Health, from the City Health Office para i-check if whether ang ginabaligya sa mga canteen vendors or concessionaires kay mga healthy nga pagkaon. Okay? So, fourth, it's a treatment of common ailments and attending to emergency cases. So, kani siya common kaayan ni siya nga ah, mga mahitabo sa isa ka school clinic. Okay, mga samad, mahubak, okay, we attend to that. And during emergency cases, adto na mo ang bata. Or if for example, need siya og emergency medical assistance, we go to the nearest hospital and then we'll call the parent or the guardian nga mo adto sa bata, or we do not leave our patient or kana nga bata kung dili pa moabot ang iyang parent or iyang guardian. Now, referrals and follow-ups of pupils and personnel. So, in the referrals and follow-up of pupils or students, since every year na atay ginatawag na medical dental consultation, okay, if the doctor, the physician, or the nurse, and the dentist would found out na naay importante nga health condition na kinahanglan siyang i-address. So, ginatawagan na mo ang parents or guardian nga i-refer na mo ang bata to a specialist. Okay, and we also do follow-ups. And every year also, kanang naami ginatawag na annual physical examination for the faculty or for the teaching and the non-teaching personnel sa school. So, moto ginakuhaan mi og mga lab tests. Okay, if naay mga abnormalities sa mo ang lab works or sa mo ang blood works, gina-follow up na mo na siya. And then we also do home visits. Okay, we also do home visits. When we say home visits, if for example, ang bata kay nag-absent siya for for successive days na pila na kaadlaw nag-absent, and then amo na siyang i-check. Okay, gina-check na mo na siya. We'll call the mother or the father or isa sa family member nila to check sa bata kung naunsa na siya. And then, community outreach like attending community assemblies and organizing school community health councils. So, every Friday, okay, ang CES office or the Community Extension Services Office, na sila yung mga feeding programs. Okay, sa clinic is, aside sa feeding program nga mo ang gina-participatean, we also give medical consultations, libre nga konsulta, and then annually na ami mga medical outreach or mga medical missions na ginabuhat. Okay, mostly sa mga partner barangays or sa partner communities na mo. And then, for the recording and reporting of accomplishments, okay, na monthly report, na annual report sa clinic, and then for the monitoring and evaluation of programs and projects. So, before the school year would end, na may evaluation nga ginabuhat whether katong mga proposed na mo nga plans for the entire school year is na-realize ba siya or wala. Okay, so do you have any questions sa ato ang na-discuss na topic? If you have questions, feel free to inbox me or send me a message in Canvas. Alright, so we'll proceed to the functions of school health nursing. Okay, so the first one is school health and nutrition survey. Okay, that, for example, she is Dr. Pepita Maape. She is our school physician for many years now. This should be done initially to provide data for evaluation and planning process. Now, the survey shall include, among others, the current health and national status of the children, situation in health facilities, as well as actual status of health education activities undertaken by the teachers and the health personnel. Second is putting up a functional school clinic. So RA 124 mandates that all schools are to provide school clinics for the treatment of minor ailments and attendance to emergency cases. Okay, so kani kompleto ato ang school clinic. Okay. Now we have the school nurse encouraged the provision of this facility. Kung example, ang isa ka school is kulang siya. So nag-request na siya og budget from the administration na mohatag para sa medical and dental needs sa mga bata. The third is the health assessment. It aims to discover the signs of illness and physical defects in order to correct them, check on health habits of pupils, and prevent the progress of those which cannot be corrected. In order to attain the purpose, the examination must be thorough. Okay, so di lang tapaw, okay, but thorough assessment. So, health assessment should include a interviewing for information gathering. Okay, so ginabuhat ni siya sa school nurse before mag-check up, or sometimes or most of the time di ay sa school physician during physical checkup or scheduled routine physical checkup. Dayon, the very first week of the school year, naghatag na ang clinic o mga survey forms or mga health information sheet para ansiran sa mama or sa parent sa bata or sa guardian sa bata kung unsay health condition sa ilahang anak. Kung naabay mga allergies, naaba sila yung mga tambal na kinahanglan i-take, okay? And other mga sakit-sakit niya. So, second one, or it should also include the nutritional assessment, like the height and the weight. It also includes the vision acuity test and the hearing test. Okay, we have the IPPA, we have the vital signs taking, appraisal of the general physical and mental conditioning, and the recording of findings. Next, we have number 4, standard vision testing for school children, like this one. Okay, so this is our optometrist. Okay, he is a friend of mine. He is Dr. Rubilius. Okay, so gina-screen niya ang students with poor visual acuity, and he identify ocular problems. Kung kinahanglan o further referral or further management, nag-refer sad niya siya to an ophthalmologist. Okay? And kani siya is naghimo sad na siya og eye glasses. Okay, he is an optometrist. Next, we have the ear examination. Okay, so children who do not see or hear will often experience difficulty in the educational environment. The early recognition of hearing loss is extremely important, not only because it may interfere with the teaching learning process as well as the school achievement, but also because the development of clear speech and social skills is facilitated by good hearing. This will also help in attaining effective treatment and rehabilitation. Okay. Next is we have the height and weight measurement and nutritional status determination. Now, height and weight measurement is a procedure for evaluating the tallness or the shortness and the heaviness of a pupil or a student. It refers or it offers the most acceptable parameter, and it is the simplest way to determine the nutritional status of the children. For example, kung malnourished ba ang bata, it's either undernourished or pwede po nga malnourished siya. Okay, next we have this one. We have medical referrals. Okay, whenever necessary, the school nurse may recommend that a student with an existing condition be referred for further assessment and intervention by the appropriate professional or appropriate agency. Okay, we have attendance to emergency cases. It is incumbent upon the nurse to attend to emergency cases while they are in school. However, majority sa mga nurses are assigned to several schools. Mo na siyang nahitabo sa public school. Dili isa ka one nurse per school. Okay? Dili na siya inana. But in private schools, that's one school nurse in every school. In their absence, school authorities and the clinic teacher have the responsibility of attending and referring them promptly. And parents must be informed of the occurrence of the emergency as soon as possible. So, again, in the absence of nurses or health practitioners during emergency cases, pwede ang katong teacher assigned. Okay? Teacher nga assigned sa clinic ang motawag ni nurse or ni doctor. Okay? And if dili makuan, siya pod ang mag-inform sa parent kung nahitabo sa bata. Okay? In student health counseling, student nurses or school nurses welcome the opportunity to help concerned parents and guardians of students in any form of individual health counseling. So, kung dili makaya nga ipa-check up ni mama or ni papa ang bata, then pwede niya yadto sa eskwelahan, since na ay doctor dito, pwede niya dito ipa-check up ang bata. The school nurse also help to make appropriate referrals either to school-provided or outside counseling services whenever necessary. Okay, kung dili available si doc sa school, okay, pwede niya i-refer sa lain nga doctor na anay contact daan si school nurse ana. Now we have for number 10, health and nutrition education activities. Now, the school nurse takes every opportunity to talk on health-related topics, both formal and informal settings. Okay, she or he would be willing to use his or her ability, her knowledge, and background to influence the school and the community in a healthy and positive way. Next, we have the organization of school community health and nutrition councils. Now, the school nurse, okay, ang school nurse shall initiate or i-encourage niya, he or she will encourage the organization or reactivation of a school community health council. The membership of which shall come from both the school and the community. And the school shall conduct school community assemblies to interpret school health problems or programs in the community. Next, we have the communicable disease control. Prevention and control of CD or communicable disease is the responsibility shared by parents, by the school personnel, the community, and the DOH. Okay? So, dili lang kay si nurse or ang school lang ang dapat nga or ang responsible or responsible nga mo tutok ana niya or mo prevent ana niya. Okay, dapat na asay coordination gikan ni parent. Okay, if a child is suffering from a recognized contagious or infectious disease, he or she should be referred and sent home and not be permitted to return until school authorities are satisfied that any contagious and infectious disease does not exist. So, kung for example, student nga gi chickenpox. Okay, so pwede ang school nurse mo papauli sa bata. Okay, the pupil or the student will be sent home and then will be asked to return if okay na siya. Okay? Para po, dili pod matakdan tong ihang mga classmates or ang mga teachers na masalamuha niya everyday. Now, the school nurse encourages immunization requirements, aid in early detection, and help to provide parental notification and information and makes any medical referrals necessary. Okay, so we have number 13, the establishment of data bank on school health and nutrition activities. Dapat accurate and dapat up-to-date ang health records sa mga bata. Okay, sa mga estudyante. Because it is essential or these records are essential in helping monitor the health status of students while they are in schools. Findings are recorded in the health examination card and reviewed and updated annually. So, kamo, naamoy mga records, naamoy individual records sa clinic that is to be updated annually. Now we have the plant inspection for healthy environment. Okay, di na siya katong tanong ha. This is the school plant or the school environment. The school plant shall be inspected in order to provide healthful environment and safety in schools. Aside from the minimum standards for schools in relation to school size, area, location, space, and sanitation, classroom, and other rooms and facilities shall be inspected for number one, dapat i-inspect kung appropriate ba ang size. Okay? Dili ba gamay kaayo? Say for example, 40 ka buok students, unya gamay kay ang classroom, dili na siya pwede. Dili pod pwede nga walay proper lighting and ventilation ang isa ka classroom. Okay? So, ang nurse ana siya tig-check kung kuan ba kaning meet ba sa minimum standards ang pag-construct ana nga classroom. Okay? Another also is the arrangement of seats. Okay? So, kani is inigbalik pohon sa mga bata after this pandemic. So, siguro, or the plan of the government is to reduce the class size, okay, to 50%. Palagyo na kaya mga bata, ana. Particular attention shall focus on the provision and maintenance of toilets, school clinics, water supplies, sanitation of school canteen, and safety and nutritional value of foods being served. So, pareha sa amo sa una, every or quarterly may naga-check sa amo ang tubig na water analysis every 3 months. Okay? And then, monthly ang inspection sa canteen and sa kuanpod. Sa mga toilets, maintenance of toilets, and other facilities na kinahanglan sa mga estudyante sa school. Okay, we also have the rapid classroom inspection. Now, it is done as a routine procedure when frequent or regular visits can be made to a school during the year, in addition to the individual health assessment. So, murag supervisor si nurse ani nga time kay maglibot-libot na siya sa mga classroom. Okay, mag-inspect na siya if ang mga bata is wala ba'y nagsakit, wala ba'y naay communicable disease ana niyang classroom, ang mga bata is limpyo ba? Okay, limpyo ba pod ang environment or ang tibuok classroom? So we also have home visit or the home visitation. Now, it is necessary in the effective implementation of the total service program, particularly the integrated school health and nutrition program. Home visitation isa na siya ka social, educational, and preventive work and should not be regarded as remedial or curative. Okay, so if you have questions, ani nga topic, you can PM or message me in Canvas. Alright, so we'll now proceed to the legal basis of school health nursing. Okay. So, daghan kaayo ang mga legal basis of the school health program or the school health nursing. First is we have the PD 603, the Child and Youth Welfare Code. So, sa tuang 1986 Constitution, in Article 1, under general principles, na dito, the child is one of the most important assets of the nation. Every effort should be enacted to promote his welfare and enhance his happy opportunities for a useful, happy life. Other institutions like school, the church, the guild, and the community in general should assist the home and the state in their endeavor to prepare the child for the responsibilities of the adulthood. Okay. Also, in 1986 Constitution, under Article 2, Promotion of Health, it should be the responsibility of the health, welfare, and education entities to assist the parents in looking after the health of the child. Okay? Under Article 3, we have the rights of the child. Every child has the right to a balanced diet, adequate clothing, sufficient shelter, proper medical attention, and all the basic physical requirements of a healthy and vigorous life. Maunay mga rights sa isa ka bata. Alright. So, next is we have the 1986 Constitution of the Philippines, Article 8, Social Justice and Human Rights. This is in Section 11. It is stated in there that the state shall adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to the people at affordable cost. There shall be priority for the needs of the underprivileged, the sick, the disabled, women, and children, and the state shall endeavor to provide for free medical care to paupers. Okay, next, under Section 12 of the 1936 Constitution of the Philippines, we have the state shall provide and maintain an effective food and drug regulatory system and undertake appropriate health, manpower, development, and research responsibilities to the country's health needs and problems. That's why natin ginatawag of Food and Drug Administration of the LDA or the FDA. So the FDA is responsible in regulating the food and drugs of the whole country. Okay, next we have in Section 13, the state shall establish a special agency for disabled persons for their rehabilitation, self-development, self-reliance, and their integration into the mainstream of society. So, para ni sa mga PWD or para sa mga persons with disabilities. Alright. So, in number 3, or in the third provision or legal basis of school health nursing, we have Executive Order number 14, series of 1946. It's the creation of medical and dental services, granting authority for the voluntary contribution of 50 centavos per pupil for the maintenance of the service. So, gamay kayo, no? 50 centavos. Pero karon is medyo ning taas na siya. Okay? For example, in his school, I think it's 220 for every student. Yeah, it charge sa inyong miscellaneous fees or I think sa school fees. Okay, kana ang 200 pesos is para na siya sa inyong medical dental. And I think wala siya gi-appeal karon since wala yung mga students nga naa din his school. Okay? Next, gi-waive na siya karon nga semester or karon na school year. We have RA number 951 series of 1947. It's the medical inspection of school children enrolled in private schools, colleges, and universities in the Philippines. So, kani appeal taan niya. So, that's why we have the annual physical and dental examination para sa mga estudyante. Okay, part na siya sa RA number 951 series of 1947. In RA number 847 series of 1953, it's the return of the medical and dental services from the Department of Health to the Department of Education. So before, ang kaning paghatag sa medical and dental services is gina-provide sa DOH. Sa una, sila ang nagdalaan nga program. Pag abot sa 1953, so gi-change nilang ang tig-provide na og medical dental services kay ang mga or ang naa sa Department of Education. So before kung ang mga nurses and doctors gikan sa DOH ang tighatag sa ilaha ani nga mga services, karon ang DepEd na sila gina-hire nga mga school physicians, school dentist, and school nurses para mag-provide sa health needs sa mga estudyante. Okay? We also have number 6, RA number 1082 series of 1954. That is an act strengthening health and dental service in the rural areas and providing funds thereof. So, kani siya is para sa mga schools nga layo sa syudad, sa mga bukid-bukid kaayo. So, dapat gina-providean sa government og igo-igo nga funds para ani nila. And dili lang ang mga doctors sa DepEd, dili lang na sila sa syudad or sa sentro nag-adto part of their or apil sa ilang scope kay ang mga schools nga naa sa bukid-bukid. Okay? RA number 2620, series of 1961, is the nationalization of the medical and dental services of the Bureau of Public Schools and Department of Education. In Presidential Proclamation number 255, series of 1967, dire is morning gina-observe nato or gina-celebrate nato ang National Health Education Week on October 10 to 16 every year. So makita niyo siya sa DOH calendar and sa DepEd calendar. Now, Article 5, Section 29, Series of 1972. So, diri gihimo ang Dangerous Drug Act. Okay? Gina-integrate ang drug education concept in the school curriculum. Mo gitawag nila karon nga NDEP. Okay, National Drug Education Program. So, that's NDEP. Next, we have PD number 9 or 491 series of 1974. Ginesignate ang month of July as a nutrition month for the purpose of creating greater awareness among the people on the importance of nutrition. Okay, sorry. This is PD number 941 series of 1974, the Nutrition Act of the Philippines. It's a creation of National Nutrition Council with DEX as a member. So sa una, ang DepEd is kinatawag na siya og DEX. So that's Department of Education, Culture, and Sports. Karon is gilahi na siya. Lahi ang DepEd, lahi ang culture and sa sports na pod. Na ay lahi nga agency para sa culture and napoy lahi nga agency para sa sports. Or commission natay CC Cultural Commission of the Philippines inapod tay Philippine Sports Commission na karon. So gilahi na siya sa DepEd, dili na siya sakop sa DepEd. Okay, so in PD 941, series 1974, so it's a creation of National Nutrition Council with DEX as a member. In RA number 856 series of 1975, that is the Code of Sanitation. Okay, that is the Code of Sanitation. Okay, LOI number 441 series of 1976 mandated the integration of nutrition education in the school curriculum. So, kani siya, nana ang nutrition sa ato ang HE. Nana ang di-integrate na ang nutrition education sa ato ang science or sa ato ang TLE. Okay, apil na siya. In nursing, kay natay nutrition and dietetics. Okay, so we have LOI number 764 series of 1977. It's the creation of School Health Guardian Program. So its concept was focused on the training of the teachers to assume responsibilities in providing school health services in the absence of school health personnel. For example, kung wala si nurse o si school nurse or si school doctor, okay, nag-train og mga teachers para mo assume as caregivers or as health caregivers para sa mga bata, okay? Then we also have Law number 764 series of 1978 declaring the school health program a priority of the national government with the aim of educating teachers and school children in the use of medicinal plants or herbal plants as a simple remedies for common ailments. Okay, we have section 938 of the revised administrative code provides that the Bureau of Public Schools shall have specified powers regarding health, teaching, physical education, and to prescribe rules on personal hygiene within the public school premises. So, kani siyang revision sa administrative code mo nang gina-provide nga mga hand washing stations sa mga schools, mga potable drinking water stations in every school. Okay, we also have section 938 We're done this one. We have EO number 234 series of 1987. This is reorganizing the National Nutrition Council. Kaya gina-revise or gi-revise yung function of member agencies like DECs have been affected. Okay, so we also have PP number 335 series of 1988. It's the observance of drug abuse prevention and control week by the third week of November. In RA 7624 series of 1992, it's an act integrating drug prevention and control in the intermediate and secondary curricula, as well as in non-formal, informal, and indigenous learning strategies and for other purposes. So, ang katong NDEP nato is integrate na sila sa secondary curriculum, meaning kanang curriculum nga ginagamit sa mga high school and senior high school. Okay, apil na po sa katong mga non-formal like sa ALS and sa mga IPs. Alright. So, in 1987, the Department of Education, Culture, and Sports, or the DECS, introduced the redirected approach in school health nursing, or the RASHN, utilizing the concept on primary health care. So, ang activities aning nga program, okay, number 1 is school health survey. Okay, so basis for evaluation performance. So every school year or every school year ang every school na sila ginatawag nga uh, health and nutrition survey. So magkuha na sila og initial nga timbang, initial nga height sa mga estudyante nila, and at the end of the month is ginakuha na po nila balik para na sila record sa. And then, mag-supply po na sila og mga feeding programs para sa mga bata. Kaya labi na katong mga children nga malnourished. Okay, number 2, functional school clinic. Okay, so dapat in every school school clinic nga pwede magamit. Third is a comprehensive pupil health assessment. So, in the comprehensive pupil health assessment, naa sila'y form na ginagamit ani niya. I-check na sa physician yearly or annually. Okay? And dili lang ni siya taphaw nga health assessment, but thorough health assessment para sa mga bata. Okay, we have number 4, referral of cases. Should there be any cases nga dili makaya sa physician or sa school physician, gina-refer na siya sa specialista. And the fifth one is a school plant inspection. So, mo na siya. Ang school environment is gina-check, canteens gina-check, ang drainage, ang toilets, gina-check na siya every month. So, attending to emergency cases. And number 7 is organize and reactivating school community health council. 8 is intensify health education activities. And 9, establishing data and school health activities. So, kani nga mga activities sa ration is maogid ni siya ang gina-follow karon nga mga activities sa tanang mga school nurses, sa tanang mga school health personnel like the doctors and the dentists. So, nakuha nila say these concepts and procedures. The approach is as premise on the following concept. Okay, number 1 is the provision of quality service in school nursing as possible only if a considerable amount of time is allotted for every school visit. Anong mahitabo niya siya? There are a lot of pupils or there are a lot of students in daghan kayong mga estudyante sa isa ka eskwelahan. And pipila lang ang number sa mga nurses and sa doctors nga maglibot-libot in every division. Okay? So, kani siyang ration, kani siyang redirected approach in school health nursing, ginapasa ni nila kay nakita nila ang need, okay? Need nga manpower para ma-attain ang ilahang goal sa school health nursing. Second is a comprehensive service is possible only if all aspects of school children can be made through health assessment instead of just plain health inspections. So, ginahimo ang thorough o comprehensive ang check-up or ang check-up sa mga bata, tanang bata sa tanang eskwelahan. So third is the early detection of common ailments and diseases among children can be made through health assessment instead of just the health plan. Okay? So, for example, na yung mga bata nga na aday sakit sa heart, okay, na adi ay cancer, at least ma-aware sila, at least makabalos sila diha dayon. Okay? So, we have number four, health assessment can be done by trained nurses to answer the shortage of physicians in the field. For example, uh, since I think in Ozamis there are only two or three physicians nga nag-attend sa division of Osamis or one baka. And then there are I think four or five nurses from the DepEd. So kung wala si physician, ginatrain na daan si school nurse para mo attend para mo attend sa shortage sa mga physicians sa isa-isa ka division. So fifth one is the health inspection. Health inspection can be delegated to teachers. So in the absence of the nurses or the DepEd nurses, naa si naa si teacher para mo conduct og health inspection sa mga bata. Height and weight, kabalo na sila mo timbang, kabalo na sila mo kuhag BMI, and then lantawon kung limpyo ba or tidy ba ng tawon ang bata, naligo ba, nanghingo ko ba. So that is delegated to teachers. Now, it is therefore assumed that with the implementation of ration, there will be, number one, increase in the number of schools given quality and comprehensive health service. Okay, since since mag-provide naman ang government og daghan nga mga tawo, manpower, and daghan nga mga facility, daghan nga mga uh, needed things para sa paglambo sa school health program. Number two, we have more availments can be discovered and attended to. Third is the improvement of academic performance of the school children with improved health. So katong mga bata nga dili halos makakaon, so since there is nanay gina-provide nga feeding program ang eskwelahan, so ganan silang mo eskwela. Gamay na lang ang mga malnourished nga bata. Pinamagid na yung mga instances nga inana nga sa kawadon sa ginikanan ang kinsa ang mag-provide ang eskwelahan or ang teachers baka. Okay? So we have number four, improvement in monitoring and reports will be completed. Okay? So here are examples or one is siya yung mga examples sa siya focus sa different levels of prevention nga naa sa school health nursing. And I will show to you a slideshow sa mga activities nga nabuhat namo sa una when I was still a school nurse. Okay? So, in primary prevention, so natin nutrition education, symposium, nakadak na niya. We also do immunizations and vaccinations. Okay, so safety health education. In the secondary prevention, we conduct screening, treatment, case finding, and home visits. For the tertiary prevention, we refer students for substance abuse or behavior patterns. And then prevention of complications and adverse effects, and faculty and staff monitoring society. Okay? All right, so that ends our topic in school health nursing. Thank you so much and have a good day.